Restart Center for Rehabilitation of Victims of Violence and Torture is a local NGO established in 1996 and active in the field of human rights, specifically the rights to rehabilitation and prevention from torture and violence. Restart Center envisions a world free of torture, where the individual's dignity, self-respect, and self-worth are cherished, and his or her physical and psychological integrity and empowerment are guaranteed. The establishment of Restart Center emerged from the need to rebuild the lives of torture and war trauma survivors in Lebanon and to restore the harm suffered by the victims whose dignity, health, and self-sufficiency may not be fully recovered without the adequate, effective, and comprehensive rehabilitation. The Center seeks to prevent torture practices nationally and regionally through awareness raising, advocacy, and capacity building, and to ensure that the victim of an act of torture, ill treatment, and war trauma obtains redress, particularly through the provision of means for as full rehabilitation as possible. In Lebanon, the unfolding economic and financial collapse that started in October 2019 and included high inflation and currency devaluations is further worsened by the dual economic impact of the COVID-19 outbreak and the associated lockdowns and the massive explosion in the port of Beirut in August 2020 that killed more than 200 people, wounded over 6,500, and destroyed large parts of the city. With these extreme challenges, extraordinary vulnerabilities and extreme escalation of torture and ill treatment have appeared among both the refugee and host country communities. A recent study showed that 46% of Lebanese are food insecure. Food prices have risen by more than 1,200%, and more than 80% of the population has plunged into poverty. This has been caused by and translates at the same time into challenges in accessing proper employment and income, education, healthcare, and other basic services. In this situation, the vulnerability of people living in poverty to torture and ill treatment, as shown in numerous studies and reports, has never been more critical. Due to the mentioned situation, and since Restart Center is an affiliated active IRCT member center since 2003, we have together successfully collaborated to provide torture survivors and their family members with critical health-based rehabilitation services as one of the main pillars in fighting against torture and violence, with a central focus on prevention, accountability, and victim reparations. Within the context of the project entitled Specialized Mental Health Services and Supportive Direct Food Assistance to Vulnerable Syrian Refugees and Affected Host Country Nationals in Lebanon, Restart Center, in partnership with IRCT and Novo Nordisk, aimed to improve the psychosocial well-being of 2,000 vulnerable refugees and host country nationals with moderate and severe mental disorders in North Lebanon and Beirut, Mount Lebanon, through the provision of specialized mental health services to 600 vulnerable people and 2,000 household food assistance. In fact, starting August, Restart Center has distributed 2,012 food parcels to 2,012 distinct households in the designated regions in Lebanon, and 1,872 specialized mental health services, including psychological, neurological, and psychiatric sessions to 873 beneficiaries among refugees and the host community. Before starting the treatment at the center, I was suffering from fear, from horror, from insecurity. I was depressed, spending my time sleeping, hopeless, and I had no energy. I lived through these feelings for 2 years and a half until I reached Restart Center and started to benefit from the provided services. After 10 psychotherapy sessions and psychosocial support, a remarkable improvement has been shown. The fear lessened. I became hopeful, full of energy, seeking for a job, and taking care of my children. I tried to regain my life and ease the life of my family. Now I am working, taking care of my family, and very thankful to what I have become. In Lebanon, civil society organizations are advocating for the eradication of torture and ill treatment by conducting comprehensive torture prevention efforts at all levels, especially through the following components. First, legal reform and implementation of the relevant laws and articles, including Law 65 that criminalizes torture in Lebanon, and Article 47 of the Lebanese Penal Code that provides newly arrested persons with their fundamental legal safeguards at the very early stage of arrest. Second, capacity building targeting relevant state agencies, notably national security forces. Third, push towards the establishment of an independent national preventive mechanism according to the OPCAT. And last but not least, media and awareness-raising campaigns to widespread knowledge among refugees and host community nationals about their rights. The healing journey of a torture survivor can be a long one, potentially a lifelong one. Restart Center strives to expedite the process of healing in order to help restore torture survivors' lives. With over 35,000 survivors being supported at Restart Center from 1996 till date, this number continues to increase. But what makes things worse is that we're not just referring to numbers here, we're talking about people. In Lebanon, torture survivors' path towards healing is even more challenging due to the economic and social situation. As a result, individuals have become more vulnerable. What's next for Lebanon? Are we doing enough? In fact, will there ever be enough when a person's dignity and self-respect are taken away? Probably not.